What happens to your body if you drink rosemary tea every day? Did you know rosemary is considered a super spice that naturally treats various health conditions? Rosemary is an aromatic plant, a member of the mint family that has been used since ancient Roman times, specifically for centuries, as a remedy for headaches, to improve memory and concentration, and to relieve gas and constipation. In recent years, its popularity has greatly increased because there have been studies that reinforce or confirm many of these medicinal properties. Today, let's explore the science behind rosemary's medicinal properties and how it can help treat conditions ranging from less serious to more serious, like digestive issues, and the latest findings on using it to treat more serious neurodegenerative diseases. Make sure to watch until the end, because there are some simple tips and recipes for adding more rosemary to your diet. Known for its fresh herbal scent, woody and distinctive aroma, rosemary primarily makes use of its needle-like leaves and its oil, which is commonly used in cooking as well as for medicinal purposes. While rosemary has many culinary applications, it has also been highly valued for its medicinal properties throughout history. But what are some of its most popular and traditional medicinal uses? The many health benefits of rosemary come from its unique active compounds and properties. Rosemary contains powerful components that have anti-inflammatory effects and gives rosemary its distinctive flavor and aroma. Rosemary is also rich in phenolic compounds, which are plant-based compounds with potent antioxidant and antimicrobial properties. If you harvest it directly from the field, be sure to clean and wash it before use. Alternatively, you can purchase it from herbal stores or pharmacies. Discover now 10 powerful reasons why you should drink rosemary tea every day. 1. Helps improve blood sugar levels. Rosemary is especially beneficial for those with prediabetes or type 2 diabetes mellitus. Why does rosemary have these beneficial effects on glucose? It would increase insulin sensitivity, ensuring that the insulin our pancreas produces is more effective. Specifically, this helps sugar or glucose from the blood to be absorbed more readily by muscle cells. Rosemary also contains some substances that have an effect similar to insulin, and this also contributes to its efficacy in regulating blood sugar. 2. Improves blood circulation. Rosemary enhances circulation by dilating the blood vessels, which consequently lowers blood pressure. Elevated blood pressure is a known factor that increases the risk of heart and brain complications. The dilation of blood vessels not only aids in lowering blood pressure, but also boosts microcirculation. In this process, smaller blood vessels and capillaries ensure more oxygen is delivered to the tissues. Moreover, waste products from metabolism are more efficiently removed. The anti-inflammatory and antioxidant properties of substances in rosemary further reduce the risk of thrombosis. However, a word of caution. Consuming rosemary tea or its other forms in excess could lead to side effects, which I will discuss later. If you have medical conditions, particularly multiple ailments, or if you're on medications, it's crucial to consult a doctor before using rosemary as a supplement. The same applies when considering other herbs, supplements, or medicinal plants. 3. Relieves digestive problems. Rosemary is renowned for promoting intestinal health. Traditionally, it has been used to address a range of digestive issues, including reducing gas and bloating, facilitating bowel movements, and relieving abdominal pains, cramps, and stomach aches. Thanks to its antispasmodic qualities, rosemary helps to relax the smooth muscles of the digestive tract, minimizing potential discomfort. This not only alleviates symptoms, but also enhances digestion. Specifically, rosemary stimulates the secretion of bile by the gallbladder, aiding in the digestion of fats, thus optimizing the digestive process. Additionally, its anti-inflammatory properties make rosemary particularly beneficial for those with irritable bowel syndrome. It's also useful in managing inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis. Rosemary also plays a pivotal role in maintaining a balance within the intestinal microbiota, the beneficial bacteria essential for our health. Its prebiotic properties nourish these good bacteria, fostering a healthy gut environment. Beyond this, Rosemary's antimicrobial attributes target and inhibit the growth of harmful bacteria and fungi. 4. Enhances brain functions. Rosemary is increasingly recognized by scientists for its potential benefits to the brain. A key component, carnosic acid, has been identified to combat brain damage caused by free radicals. Moreover, rosemary assists in breaking down a chemical in the brain named acetylcholine, optimizing nerve cell communication and, consequently, improving memory and concentration. Its benefits extend beyond cognition. Rosemary is also reputed to elevate mood and alleviate symptoms of anxiety and fatigue. Many of these beneficial properties have been confirmed through various studies. It's intriguing to note that even in ancient Greece, over 500 years before Christ, students utilized rosemary for its remarkable effects on memory and concentration. Part of rosemary's benefits for the brain can be attributed to the improved circulation discussed earlier. This enhanced circulation can reduce brain damage following a stroke, whether from a hemorrhage or an obstruction caused by a clot. Its antioxidant and anti-inflammatory effects possess neuroprotective properties. These are especially valuable in preventing neurodegenerative diseases, including Alzheimer's, other dementias, and even Parkinson's. 5. Anti-inflammatory effects. Rosemary possesses notable anti-inflammatory properties. This makes it an ally for those experiencing joint pain with inflammation, as seen in conditions like arthritis, osteoarthritis, or muscle pains. These benefits can be derived from both incorporating rosemary in daily cooking and consuming it as rosemary tea. Additionally, research suggests that applying rosemary essential oils directly to affected areas can reduce pain. 6. Helps combat stress. Consuming a cup of rosemary tea daily can be particularly beneficial during periods of heightened stress or anxiety. It also aids in improving sleep quality, thereby addressing insomnia associated with stress. 7. Strengthens the immune system. Rosemary enhances the immune system, reducing susceptibility to infections. Its antimicrobial properties, coupled with antioxidant and anti-inflammatory effects, make it adept at inhibiting the growth of viruses, bacteria, and fungi. Historically, these properties also led to its use as a natural preservative, extending the shelf life of foods. 8. Detoxifies fatty liver. Rosemary proves advantageous for liver health by minimizing the accumulation of dietary fat within the organ. It's not only beneficial for those with fatty liver conditions, but also provides a protective shield against cell damage or inflammation triggered by medications or toxic substances. If you're facing liver issues, consulting about incorporating rosemary, whether as a seasoning or through rosemary tea, might be a prudent step. 9. Beneficial for skin and hair. Rosemary offers multiple benefits for skin and hair health. It combats premature aging, promotes wound healing, and provides relief from conditions like seborrheic dermatitis, acne, psoriasis, and alopecia areata, characterized by hair loss in patches. Its efficacy in these areas is backed by evidence. 10. Eye benefits. Rosemary has shown potential in promoting eye health, specifically by combating signs of aging. This can slow the progression of cataracts, opacity of the eye's lens, and age-related macular degeneration, a condition affecting the back part of the eye that can lead to blindness as one ages. The compounds and substances in rosemary have been identified to not only reduce the risk of these conditions, but also to significantly slow down their progression. What are the factors that contribute to the health benefits of rosemary? These rosemary's benefits are attributed to polyphenols known as carnosol, rosmarinic acid, and caffeic acid. These compounds are recognized for their powerful antioxidant, anti-inflammatory, and antimicrobial properties. Additionally, there are other types of polyphenols called flavonoids, such as apigenin and luteolin, which interact with these other substances. It's essential to note that while a significant portion of this research has been carried out in laboratory settings using test tubes and animals, many of these benefits are gradually being verified through human studies. How can rosemary be used? Infusion, same as tea. This is a popular method where rosemary leaves are steeped in hot water to produce what many refer to as rosemary tea. Decoction. Different from the infusion method, decoction involves simmering rosemary, typically the tougher parts like stems, in water. This method extracts deeper flavors and compounds from the plant. Culinary uses. Beyond these preparations, rosemary is a favored ingredient in cooking. It is commonly available in powdered form, as well as various extracts available in the markets. Rosemary serves as a protective agent against toxins that can form in food. Notably, when meats are in high cooking temperatures, such as grilling, barbecuing, or frying, harmful compounds called heterocyclic amines emerge. These compounds are associated with certain cancers, including colon, breast, and prostate cancer. A study found that marinating meat with seasonings, prominently featuring rosemary, before cooking can reduce these toxic elements by up to 90%. While the foremost strategy should be moderating the consumption of overcooked meat or fish, integrating rosemary into the cooking process is also a commendable approach. Supplements and capsules. For individuals looking for a more concentrated intake, rosemary supplements or capsules are commercially available. These capsules are often filled with powdered rosemary, capturing its essence without the need for preparation. Tinctures and topical uses. Rosemary tincture, a liquid extract often combined with alcohol. When taken orally, it serves medicinal purposes, offering a concentrated dose of rosemary's beneficial properties. Rosemary essential oils, when mixed with a base oil, can be applied directly to the skin. This method offers a range of benefits and is often found in various cosmetic products, including ointments and creams. Aromatherapy and fragrance. Rosemary has established its presence in aromatherapy, providing relief from stress and promoting relaxation. Whether diffused, added to baths, or used in massages, its aromatic essence is cherished by many. A simple method many people enjoy is placing some rosemary sprigs in water, which acts as a natural air freshener, filling the surroundings with a delightful aroma. Additionally, rosemary has found its way into gardening for decorative purposes and has been used as a disinfectant. How to prepare rosemary tea. Ingredients: 1 or 2 teaspoons of fresh or dried rosemary leaves, 250 milliliters of boiled water, a standard cup. Optional: sweeteners like sugar, honey, or maple syrup. Preparation: if using fresh rosemary leaves, ensure they are cleaned thoroughly. In a pot, bring the water to a boil over medium heat. Once boiling, reduce the heat to low. Steeping: place the rosemary leaves in a cup. Pour the boiled water over the rosemary leaves. Allow the mixture to steep for 2 to 3 minutes. Serving: you can then drink this tea either hot or cold, based on your preference. Some people like to strain it first to have a clearer liquid, but either way works. Note: while some may choose to add sweeteners, enjoying the infusion in its natural state allows you to fully appreciate its aromatic and beneficial properties. Preparing rosemary tea using decoction. Ingredients: 1 or 2 teaspoons of fresh or dried rosemary leaves, 250 milliliters of water. Preparation: first, bring water to a boil in a pot over medium heat. Once boiling, add the rosemary leaves directly to the boiling water. Reduce the heat and allow the mixture to simmer for about 5 minutes to ensure the rosemary's nutrients are fully dissolved. Serving: once done, strain the liquid. This brewed mixture can be enjoyed either hot or cold, based on personal preference. Some people enhance the flavor by adding a touch of sweetness, perhaps with honey, or a splash of lemon. Note: decoction typically results in a stronger flavor than infusion. While it's believed that a decoction helps in extracting its valuable substances and nutrients more effectively, the choice between the two methods often comes down to personal taste. What are the potential side effects and risks of rosemary? As with any consumable product, there's a potential for allergic reactions with rosemary. This risk exists whether rosemary is consumed orally, as in tea, seasoning, etc., or applied topically to the skin. For those with skin issues, it's imperative to consult a dermatologist before applying rosemary or its products directly to the skin. It should not be applied directly to open wounds or burns. Consuming rosemary in excess can lead to digestive problems. Drinking more than 2 cups of rosemary tea or infusion daily might result in symptoms like bloating, abdominal pain, nausea, or even vomiting. While rosemary offers various health benefits, it's essential to consume it responsibly. As always, moderation is key, and if you are new to consuming or using rosemary, start with small amounts and observe how your body reacts. If any adverse reactions are noted, discontinue use and consult with a healthcare professional. Furthermore, rosemary is not recommended for individuals with symptomatic gallstones. Since rosemary increases bile secretion, there's a risk of expelling a stone, which can lead to complications. Additionally, in individuals with bleeding disorders should avoid, due to its mild anticoagulant properties, rosemary might be problematic for individuals with conditions that predispose them to bleeding. Anyone with a bleeding disorder should consult a medical professional before consuming or using rosemary. In addition, rosemary consumption is not recommended during pregnancy or breastfeeding due to limited available data on its effects. In the case of medications, rosemary might interact with blood-thinning medications, potentially amplifying their effects. Antihypertensive medications, such as enalapril, lisinopril, and losartan, may have intensified effects when combined with excessive rosemary consumption. Besides being prescribed for blood pressure, diuretics are also used for heart and kidney concerns. Rosemary might affect their efficacy. Anti-diabetic medications. Rosemary could enhance the impacts of insulin and metformin. In all situations involving medications, it's essential to exercise caution and consult with healthcare professionals regarding potential interactions. Just a quick reminder, this video is for educational purposes only, and if you're concerned about your health, always consult your healthcare provider. If you found this video helpful, give it a thumbs up and consider sharing this information with your loved ones so they also will know all the rosemary's benefits. If you want to stay informed about health and well-being, subscribe to our channel and hit the notification bell to stay updated with our latest content. To gain further insights into naturally healing your body and preventing undesirable illnesses, you may also find additional interesting videos popping up on your screen right now. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you so much for watching. Bye.